Hello everybody, my name is Dr. Ibrahim Khan. I am a family medicine practitioner with Lake Region Healthcare. This is the third in the anxiety lifestyle modifications video. I hope you caught the first two. The first was on the basics, food, water, sleep. The second was on personal activities, exercise, hobbies / pleasurable activities, and social activities. This is going to be on the monk-like activities. So if you think of like this Zen-like monk, that's how I think about it. They're always kind of calming themselves through prayer, meditation, and other techniques. So this is going to be focused on those kind of aspects of lifestyle modification that I think could really help with combating anxiety specifically, but even other mental disorders as well. So let's get into it. The first one, prayer and meditation. And I like to say it that way because if you are not religious, you don't necessarily have to feel obligated to pray. You can also meditate. If you're religious and you want to pray, if you're not religious and you want to pray, that's absolutely fine too. And they're not mutually exclusive. You can also pray and meditate, but both those activities, a lot of research has shown, really can help anxiety. If you think about it, it's taking a time away from your regular day, stepping away from some of those things that can really possibly stimulate you in a wrong way to maybe have some of those worrisome feelings. You're taking a time out from your life and you're going to focus on the prayer or the meditation or even both. If you'd like. I think that aspect does two things. One, you're naturally decreasing the amount of negative thoughts that you may be experiencing in your life because you're taking yourself away from that possibly stressful, worrisome stimulus. And the other is that you're boosting the positive. A lot of prayer focuses on what you have and being thankful for that. Increasing those positive thoughts either through prayer or through meditation. Specifically, gratitude has been studied in literature. There's a lot of literature, current literature, that actually suggests that focusing on things that you are grateful for, even sometimes enumerating those multiple times a day or a week or whatever is comfortable to you, that really shifts your focus in those positive directions. Some of the research has shown that it's not only helped anxiety, it might even have the same effect as like low dose medications that your primary health provider can possibly suggest. So again, a lot of people say that they don't necessarily want to possibly explore the medication route of altering their brain chemistry or hormone levels. So again, this is another way that we can do that on our own. The literature is showing similar effects to low dose medications if you focus on gratitude for some people. So these might be some techniques, prayer, meditation, various types of prayer, meditation, whatever works for you might really help your anxiety. So that's the first thing that I'd like to suggest incorporating into your life on a regular basis. The second that I'd like to suggest to you is something called mindfulness. So what is that? Mindfulness is a series of techniques that get you to be mindful of the present. So much of our life, I feel, I'm not sure if you feel that way too, can possibly be focused on the past and maybe make us feel guilty, or focus on the future and maybe make us feel anxious about what's to come. And sometimes we're not just focusing on the present where we are right now. And being able to do a series of exercises that can focus us on the present, even if it's for just a small amount of time, can really be helpful in reducing our anxiety and some of those thoughts and feelings that we're having. So mindfulness techniques, there's so many of them. And if you do research on your own online or in your library or wherever, you'll find a ton of different mindfulness techniques. There are some breathing exercises. An example of that might be box breathing. Again, you should check with your healthcare provider to make sure that you don't have any health conditions that might limit breathing exercises, but controlling your breathing and a series of breathing exercises can help to calm you and to decrease anxiety. There are body scanning methods where you focus on different parts of your body and focus on relaxing that, starting from your head to your toes or vice versa. And it can really kind of help to really reduce your anxiety. Again, there are a number of videos if you'd like to check those out online on some of those techniques. Yoga is another one that really makes us focus on the present. Believe it or not, there's even mindfulness exercises where we focus on taste. There's the famous kind of raisin mindfulness exercise where we take it, we focus on the texture of it, and then we might smell it, and then we finally might taste it. And we focus on those aspects of what we're doing with the raisin for example, to really put ourselves in the present. It can also be even personal. Me personally, I might take a time out for a cup of tea or some water or some coffee. It removes me from the situation for a small amount of time, and I can calm myself down. I focus on that drink and some of the pleasure that I'm getting from the taste of that tea. Another one that I do personally is I'm into fountain pens. You can make fun of me for that if you'd like, but if I've gotten a new pen or even take out an old pen that's one of my favorites, if I'm in a stressful situation, I might just take 10 to 20 seconds to focus on, well, I'm using one of my favorite pens with one of my favorite nibs, and I just got this new ink color that I loaded into it from the ink bottle, and I'm looking forward to writing with it, and I focus on that, and then I might write down some of the things that I'm needing it to, but just that small time out to take to kind of focus on something just a little bit separate. So I would encourage you to look up different mindfulness techniques on your own if you find them useful. I'd also encourage you to check with your primary care provider to see if you have any contraindications. Sometimes if you have past trauma or another psychological condition in the past, it may not be the best idea to engage in this. So check with your primary care provider is always a good idea, but I think mindfulness techniques can be huge and very, very useful in calming your anxiety. So prayer, meditation, mindfulness techniques, those are two, and I call them like the monk-like category of things that can really help anxiety. I hope you found these helpful and can apply them in your life. Take care. We'll see you next time.